In this Powtoon, we are going to be talking about ABA across the lifetime. ABA stands for Applied Behavioral Analysis. It is a service that can be provided to individuals with behaviors including, but not limited to, autism, ODD, significant emotional disorders, eating disorders, substance abuse, traumatic brain injuries, and any other condition that may require a functional analysis of behaviors and the implementation of the interventions that will support the client involved in behavior, social emotional needs, and functional life skills. A question that might be asked is, when can ABA services be applied? Applied behavioral analysis can occur as early as 18 months upon diagnosis of the individual, and services can be applied and given across the lifespan depending on the needs of the individual. The purpose of ABA is to support the individual so eventually the individual will have the necessary supports to live functionally and hopefully independently. Across the lifespan could mean 18 months till the end of the lifespan, depending on the needs and condition of the client. Now, this information is for professionals. An important aspect of ABA to remember is that every client that will be worked with is different than other clients, and reinforcement for one client may not work for another. This is especially important when considering the condition of the client and the behaviors that they exhibit. For instance, an elderly person who suffered a stroke may utilize ABA services to reduce the aggressive behavior exhibited through use of verbal obscenities. A behavioral therapist may be able to understand that the function of his behavior is escape from his least favorite caregiver, because through data analysis, the behavioral therapist is able to see that the client does not aggress against the caregiver that is preferred. Another example is with a teenager who was in a car accident and suffered severe brain damage, and every time in public the teenager breaks down in tears. An ABA therapist could speak to the parents and the teenager to gain more information and then collect baseline data as to times it occurs, where in public, and to then determine the function of the behavior. In this case, the function of behavior is an escape, because whenever the teenager is in public and sees a car that looks similar to the one that hit them, they're going to be in the accident again, and it replays in their mind. This particular scenario would require time in getting to know the teenager and actually taking the time to speak with them despite the traumatic brain injury. Professionals need to understand that services can be given across a lifespan. However, those services cannot be all the same, because not everyone is the same. The services that will be delivered should be consistent to what the client requires, whether that is verbal communication skills, behavioral coping mechanisms, increased emphasis on functional living skills, workplace relationships, or any other behavior or scenario that could use the help of an ABA therapist. The purpose is to support, learn, help, and work with those who need to improve in an area that involves behaviors. Finally, parents are also an integral part of the ABA team. And parents and caregivers, because this is a lifespan therapy, need to remember that this can be applied and that there are many providers who do not end services at just 7 years old. There are providers who continue services until the child has graduated from the program and has made improvements in the areas of concern that the ABA therapist was supporting them in. Also, and again to reiterate, parents and caregivers are an integral part of the support team that includes the ABA therapist, because they need to comply with the interventions set by the ABA therapist so that the child or adult can continue to make strides. The parent or caregiver can also make suggestions based on past interventions or current interventions because of the knowledge that they have on their own child or person in their care. ABA therapists depend on parents to implement and support interventions while also wanting the opinion of the parent or caregiver to make sure that they are seeing results in their areas of concern. Finally, ABA therapy is across a lifespan. The therapy is meant to help and support so that the individuals who receive therapy, their families, or their caregivers may all benefit and increase in their functionality and life skills within their lifetime. ABA therapy is important because it's not only an emphasis on just behaviors for autism, but it's for any behavioral disorder or any condition that is affected by behavior.
created using Powtoon.